I think the great thing about Yard Central's working with the Ministry of Health in each country is that you're developing the model is how you want it to work for yourself, for your own ministry. So I'm the EPI Immunisation Coordinator in Samoa. Just a background in case some people may not know where Samoa is. If you travel east for an hour or so, you'll reach Samoa. It's a Pacific island, two main islands, and two smaller islands that are inhabited. 2,800 square kilometers. We've been an independent nation for 60 years. Our population census in 2021 is 205,000. Our birth rate is 24 per 1,000. Life expectancy is 73 years. And the majority of the population is under 30. So we have 8 hospitals, 4 health centers. Our yearly birth cohort is 5,400 to 5,600 children. 8 to 10% of those are home births, not necessarily in the hospital, but home births. As you all know, we had a measles outbreak in 2019, and out of that post-measles recovery plan, we were to review and update our e-registry for immunizations. We also had the Infant Amendment Act in 2019, which was also a very significant turning point for our immunizations in Samoa, where children, when you go to school, have to have an immunization record and be fully immunized on school enrollments. And I also call this a great catch-up, because with the measles outbreak, there are many children who hadn't been vaccinated with measles, but we also found that there are many children who had not completed the majority of their immunization. So we had a great catch-up for immunizations. And also, besides the COVID pandemic, we also introduced polio vaccines under the new vaccine project in the last 2 years. So that's a lot of data. Is that right? A lot of data. Okay, so just listening to fire, you can visualize our hospitals and our health centers on there. Example of the use of Teuila Pati. So where we were before with our immunization records, we had a very fragmented record system. It was paper-based. This is now paper-based records for some reason or another. So every health facility had paper-based hard copy records. So you can imagine 20 years of immunization records, the papers would be becoming torn or lost or ripped out of the papers of the books. So we had different registry books for infant-based, hospital-based immunization, like the children who were immunized in the hospitals, and they grew up, they went to school, their immunizations done in schools were put in another book. So there's a lot of data that was all over the place. We had the introduction of the WHO IMU heat system in 2016, but it was a very underutilized system. After the measles epidemic, Manistina knows very well because she spearheaded it. We did a big transfer, a huge transfer of all our hard copy-based records into this IMU system. There are a lot of lots of immunization records. People are coming up wanting their children's records, but we didn't have them, we lost them, they were destroyed in cyclones or whatever. So there are some people who are not very happy with that. It's a poor documentation record system. And also the patient medical records were not connected to our immunization records. It was a totally different system. So sometimes it was the same child and the patient records would have a different name as our immunization records. And of course, a lot of identification issues, multiple names, lost records, and incorrect entries. So the challenges at the time, we had incomplete registration of births at hospitals and in health facilities, incomplete immunization records, even between health facilities, you couldn't really access the immunization records from between one health facility and another, unless you bring, and sometimes it can be such a long delay. So we were very, there's a lot of uncertainty about a child's immunization status, because this is what we based our catch-up immunization on. So sometimes children would have to be immunized twice because we're not sure of their immunization status. We'll just start the whole processing. So, and then we're not able to ascertain accurate immunization coverage, not just for our routine, but going back, the recent measles scare, earlier this year, the government was asking, okay, what's our immunization coverage? But they wanted like 5-year-olds, 4-year-olds, 3-year-olds, so we don't really have that. They're not able to present that data. Okay, so the other thing too that's quite maybe unique to Samoa, but it also might be an issue in a lot of Pacific Islands is the identification and adoption issues. We love changing our names. Like sometimes we can change our names 2 or 3 times in our lifetime. Our home births, sometimes there's a weakness and delay in notification of so like typically you should be registering your child with some Bureau statistics within 3 months. A lot of children are not registered until they're 10 years old, and by that time there are a lot of inconsistencies with the date of birth. It could be a year's difference, which is bad. So with the school enrollment now, children have to produce a birth certificate. And also too, there's a lot of adoptions, like Samoan adoptions, where maybe a child may be left at the hospital or given to another family member, and that's without the usual legal process or legal. So a child may not really have all the details of their biological parents. And now to push overseas adoption, it's becoming more and more common, usually within extended families. There's a process that we need to change a child's name legally. And of course, when it comes to the immunization record, it's a very important requirement by the overseas country. So where we want to be, so it's good that we heard that there's no perfection in digital systems. So we want to be, we want to have a one-stop comprehensive health record for the patient. So with Tamanu, which I think we should call Inara, Tamanu is like some sort of Pacific warrior, but I mean, it's been such a long process, isn't it? In our so one-stop health record. We have your patient's records and your patient's immunization. So we also real-time registry of births, like when a child is born, we can now register them straight away, whether they're in the main hospital of an RP or wherever they are born in the health facilities. Once they're born, you can have real-time registration of the births. And also, where we want to be is to be able to enter these immunizations straight away, immediately. If the child is being immunized in the clinic, they get in straight away into the Tamanu. If they're out, being in the outreach, and nurses take their tablets, they can enter these immunizations immediately at site. That's the perfect mode. So also too, where we want to be is have this immunization data, real-time availability, have immunization records available wherever this person is. So usually children do move around within Samoa, like they could start off on one side of one island and they end up in the other side of the island. But with Tamanu, that record can go cut down on our paper-based records. I think we have maybe 2 or 3 rooms full of paper-based records that we want to get rid of. And we also really need to monitor any changes and amendments to personal information or identification, which I'll not go into any much detail. Okay, so the transition to Tamanu e-health, I think we initially met with Michael Nguyen several years ago, and then Ashley, and now Tim is your representative in Samoa. It's been a great journey. So it's been a long process in the midst of COVID-19, where we're able to get the immunization system up and running for vaccinations and printing of certificates, especially when people started traveling. they needed a digitalized immunization certificate. So that was the start of using our immunization records. Because of all the information that was in the WHO system, Beyond Essentials is bravely we're able to export all that information from type. I'm thinking, oh, it just takes probably a magic wand and they'll do it. I don't really think that sounds really exciting. But they were able to, we have, I was told 142,000 entries or children registered in the WHO system that we were using, but that included multiple duplicates. But we were able to extract 23,000 direct matches and enter into Tamanu, and this was based on the same name, gender, legal group, and Muslim. So, of course, there's nothing that is perfect, but it was definitely a big step for the Tamanu in our record system. But we did have a few issues with the correct immunization states, which is starting to correct. So there's still a lot of work to be done. There's still a lot of backlog of information records that need to be entered manually, and we have probably about 3 or 4 or 5 years of children that need to be registered into Tamanu. These were the children that were born like from 2019, 2020 up to this year. So we're aiming to introduce the use of our Tamanu generated routine immunization certificate in October of this year. So with our Tamanu immunization model, it starts at the birth or return of the child. As I said before, when a child is born, we have trained, our team has trained staff and midwives. The midwives to register the child on Tamanu, and then they're given a unique ID number. And this number is entered as well into the child's immunization health book. So when the child goes to the health facility for their first immunization at 6 weeks, it's very easy for the nurses here to identify the child. And we're also able to enter historical immunization data going back 20 years. And so from this immunization, we have 2 outcomes. We have immunization certificate, and we can also see the immunization coverage. Okay, so we have so with the real-time data to find the overlay, we can visualize each coverage for each vaccine with Teuila. We can easily identify high-risk areas. We can use it for our annual coverage for reporting, and we have been using it for school immunizations, HPV, and typhoid rollout campaigns. So that's a picture of a typical HPV vaccine that was done this year, I think. So Samoa is all red because they have either not vaccinated or they haven't entered the data. So I think I've talked about that. Next steps forward. We need to finalize our immunization certificate. We need to also provide public awareness, inform schools, Ministry of Education, and also our consulates that will be using this new immunization record. So we also need to ensure that all the health facilities are using the Tamanu system, provide training support to the nurses. They are the most important people in this project, because if they don't enter the data or they don't see the value of this, then they're not going to do it. And then also monitor usage and create data entry and streamline the processes of adoption. So thank you from our children of Samoa, and I'm sure the children of the Pacific for all the work that you've done.